Hello everyone, Sam Gilbert, Club 360 physiotherapist here. Today we're going to be talking about red flags. Now, this isn't the sexiest topic, it's not really the most pleasant topic to speak about, but it is something that I believe people should be aware of. In clinical practice, there are approximately 1%, according to statistics. In my clinical experience, it's actually less than that. But there is a small number of conditions whereby things that are not musculoskeletally related present in the same way as musculoskeletal problems. So you might have lower back pain that feels like it's a muscular issue or feels like it's a problem with the disc or the joint, but in actual fact, it might be something more serious. Some of the common things that we see are malignancy, tumours, fractures, infections, and something called cauda equina syndrome, which is basically a compression of the lower part of the spinal cord. As physiotherapists, we're taught to screen for these conditions, both with our subjective assessment, the questions that we ask a client when they first present, as well as our physical examination. And through that examination, we're able to identify or raise suspicion of where a musculoskeletal condition might not be present, and it might actually be a medical condition that's masquerading. And in these cases, we basically refer to the appropriate practitioner so that that person undergoes the necessary examination. Now, I understand that not everyone who experiences pain is necessarily going to present to a clinician. You might have some soreness and niggling back pain, niggling knee pain that you can sort of work through, and for a lot of people, that they can put up with something that's not interfering with their function, and they might not seek treatment. However, if you do have pain and you choose not to seek assessment or treatment for it, it is important to know what these common signs of something masquerading would be, so that you can then decide if further investigation might be necessary. So, some things to look out for. First of all, if you're aged over 50 years, now this is still, in my opinion, very, very young. However, according to the research, if you're over 50 and there has been a recent trauma, then there is a far greater likelihood of a fracture being present. So if you're over 50 and there's been some sort of acute trauma, some sort of acute accident, then it is always important to get an X-ray or whatever relevant diagnostic scanning is necessary to rule that out. Progressive symptoms, so if you have something that's getting worse, in particular if you're receiving treatment for this condition and it's getting worse, or if you're abstaining or decreasing what you assume is the aggravating activity or factor, and things are still getting worse, then that is something that needs to be taken a little more seriously. So if you assume that cycling is causing your back pain and you back off on your cycling and it's getting worse, or if you're receiving some sort of treatment, then that is considered a red flag. In particular, if they're neurological symptoms, so if you have some back pain that's causing what's often called sciatica, so pain in the back of the leg, and you start to experience numbness and weakness, and those symptoms are worsening, then definitely that is a red flag and something that needs to be investigated further. Cancer, if you have a previous history of cancer, this is definitely a red flag when you develop a musculoskeletal condition, especially gradual onset lower back pain. This is basically, if you have something going wrong, previous history of cancer, that equals greater possibility of this being related to a malignancy. And in particular, if you've had lung cancer, renal, prostate, breast or thyroid cancer, those 5 in particular are cancers that are known to have a greater correlation with a spinal tumour. Family history of cancer, so if you've had family members, and particularly if you've had multiple family members that have had cancer, then that also increases that index of suspicion. Weight loss, so in health and fitness, if people are being active and being sensible with what they eat, they might have weight loss goals, and in general that's a positive thing. But if the weight loss that you're seeing isn't really correlated to dietary intake and activity levels, and it's happening a little bit quicker than you would expect, then that is also a red flag and something that needs to be checked. Bladder and bowel dysfunction. So if you're having any change to your toiletry habits or sensations with bowel movements or passing urine, then this is definitely something that needs to be screened, as is any sort of sexual dysfunction. So these are things that we would associate with cauda equina syndrome. So if you have lower back pain and you're starting to experience bowel, bladder or sexual function, then this is something that needs to be investigated. Saddle numbness. So when we talk about the saddle, sort of the area on the inner part of the buttock, if you imagine riding bike or riding horse, the bit that's in contact with the bike seat, that's your saddle. If you're noticing numbness there, this is a red flag. Neurological impairments, so basically numbness anywhere really needs to be checked out. And if you're noticing that you've got weakness, not that you're just inactive and haven't been training so much and you're just feeling a little bit deconditioned, but if you're actually noticing, especially if there's a difference left and right, that you haven't got as much power, either some of the common ones are the foot function. So these are related to different areas of the spine that might be affected with a compressed nerve, but if you're having trouble pushing off the ground, or if you're having trouble pulling the leg up or pulling the foot up, this is indicative of some sort of neurological deficit, and that needs to be assessed. Drug abuse or long-term medication use, both of these have the ability to impact immune function. So if you have had a long history of either prescription or a non-prescription medication or drug use, then this needs to be taken into consideration with your symptoms and assessed accordingly. Any recent infections, even if the infection has resolved in the area that you're experiencing the infection in, then you still need to check and make sure that it's not impacting the symptoms that you're currently experiencing. Night pain, people with musculoskeletal pain will often experience pain at night. So if you have back pain, it's not uncommon for once you're immobile for a certain amount of time and then you go to roll over in the night, it may cause some pain. In general, if you have inflammatory conditions, if you have an acute injury, that there's an element of inflammation. If you lie down for several hours at a time, that inflammation sort of pulls and the nerve receptors in the area become more sensitive. So pain at night is commonly associated with musculoskeletal injury. However, it may also be indicative of a tumour or of a central inflammatory condition. And so, it is important that if you are experiencing night pain, that's probably at a severity. If it was just a musculoskeletal condition, that's probably a severity of pain that you should probably be looking at getting that checked out anyway. But when you speak to your healthcare provider about the symptoms you're experiencing, do mention that the night pain is present, because that may change the assessment and change the way that they are looking at your symptoms. Stiffness in the morning, so again, your typical lower back pain will be stiff in the morning. However, if you're past the acute phase and it's, or if it's a gradual onset of lower back pain and it's really stiff for, say, 30 minutes in the morning, this may be something like ankylosing spondylitis, a systemic rheumatological condition for which the management will be different to that of a regular mechanical or inflammatory back pain. So again, this is something that we do need to get checked out. Likewise, there are other symptoms that are suggestive of a rheumatological condition. If you have pain in a certain area, but you've got accompanying signs, issues with the eyes, with the skin, with the hair, if you've got swelling around the fingers, if you've got stomach disturbances, those sort of symptoms, especially if you have two or more of those type of symptoms, in collaboration with pain, or if you have pain in multiple areas, and in particular in what we call the enthesis, the attachment of tendons or muscles to the bone. If you have multiple sites of that type of pain, then that is also suggestive of a systemic inflammatory or rheumatological condition. So that is something that needs to be discussed with a healthcare professional as well. Systemic symptoms, so perhaps you might have had an onset of back pain, but at the same time you're also experiencing fever, malaise, fatigue, tremor, night sweats, discoloration. The fact that this is coming on at a similar time to your lower back pain or whatever musculoskeletal condition you're experiencing is also a red flag. And then thoracic pain, so pain in the rib cage, pain in the thorax area. Obviously, this may be a musculoskeletal condition. We can have muscular and joint-related pain in those areas, but they are areas that do lend themselves to other conditions, masquerading as musculoskeletal conditions. So any pain in that area really should get checked out. So I hope that, first of all, that hasn't terrified you. Some of these things are normal. You might experience sweating because you're hot and you're someone that perspires a lot, as I do. But if you are experiencing these symptoms and you haven't experienced them before and they're there in conjunction with musculoskeletal type symptoms, then please do go and see your doctor or do present to a physiotherapist and we can provide a full assessment and make sure that we're not dealing with anything that would require a different type of management plan or a different stream of diagnostic testing. So I hope you found that interesting and informative. Please don't forget to like and subscribe, and we will look forward to speaking with you on the next episode. Thanks for watching.